Nationally, we know that flu cases are on the rise. What are we seeing at Beacon and across the region?
Well, what we're seeing is the same spike in cases that we're seeing at the national level. In fact, at our local hospitals, we're seeing quite an increase over this last week in the number of folks who are testing positive for influenza. Though I will say it's nice that the number of folks hospitalized with influenza is a little bit lower this week than it was in the last couple of weeks. Still, the national trend is to expect that there's going to be more cases before we get to the end of this year's flu season. And regionally, our vaccination rate is just under 50%, which means there's plenty of folks out there who'd be at risk.
So, why should people be taking this seriously?
Sometimes we think about influenza being a fairly common thing that's not such a big deal. And for a lot of people, that's true. However, folks with a lot of medical conditions, folks at the ends of the age scale, both older and younger children, are likely to take this a lot less well. And so we want to try to protect them the best that we can. Every year, there's a lot of hospitalization and a few deaths from influenza. These are avoidable mostly.
And what is your advice for everybody watching?
If you're sick, the first thing to do is get a phone call off to your primary care office and have a conversation with them about what you need to do next. That might be an office visit or it might not. It might be a test or it might not. But having that conversation with your trusted medical team is going to be the starting place for sure. Beyond that, it's a lot of common sense. If you're sick, stay away from folks. Stay home, or if you have to be out, keep some distance and maybe put on a mask. Not talking about masking guidelines like back in the COVID times, but you being in a mask yourself will help prevent that germ being spread to other folks. So do that if you can. Plenty of hand washing and cleaning of other surfaces that could have viruses on them is a good idea too. And then remember, vaccines save lives. If you are not vaccinated or know someone who isn't, now's a great time to go ahead and get that taken care of. And even though our match this year between the vaccine and the circulating strains of influenza A is not perfect, it's still better than nothing and often prevents hospitalization and death.